Let's go to Part B, like boy. This one is your doctors. So these are the doctors that see you in the hospital. They are the procedures in the hospital, the medication in the hospital. They are your primary care physician outside of the hospital, as well as every doctor outside of the hospital, the chiropractor, any specialist that you go to, the oncologist, even injections that are given to you through a doctor is covered under Part B, like boy, of Medicare. Now, this one does have a premium each month. $174.70 is the normal premium for 2024. That is per month each. So if there are two of you, you will pay that each month. $174.70. The exceptions to that premium are people who are on Medicaid, and their premium is paid by the state, by the Medicaid office, and so they pay it's a zero premium. Now, the other exception are people who make more than the norm, and that premium can increase up to over $570 per month, depending on your income. What they're looking at is 2 years back, how much did you make? What was your adjusted gross income? And you can see what those charts will be if you just search IRMAA, IRMAA, and that chart, believe I've got it on here. Perfect. So this is what the IRMAA looks like right now. If you're single, you need to have made $103,000 adjusted gross income or less 2 years ago. So we're talking about the taxes that you filed in 2023 for 2022. If you are higher than that, you're going to pay an IRMAA, which is that adjusted premium for making more money than the norm. Now, come down here. This is somebody who's a little higher. That premium is going to go from $174.70 up to $244.60. Notice that if you have an increase on Part B, like boy, you also will have it on D, like drug. And please know that whatever your plan premium is, you will have to pay this increase amount as well for your drug coverage. That's something when you get to your one-on-one, we'll go over in more depth so that makes sense to you. So coming back to Part B, we've talked about the premium. You also have a deductible. This one is annual. Part A was each time you go to the hospital. Part B is annual. $240 you pay it once, and then you're done. However, after you pay that deductible, you then have 20% coinsurance, a percentage of coinsurance that you are responsible for. So Medicare Part B pays 80%, you pay 20% for everything that happens to you medically. Now in the hospital, this is 20% of any procedures, hip replacement, any doctor that comes and sees you, you're going to pay 20% of that bill. Every lab costs, every medication, and everything outpatient as well. Any surgeries that you have in the surgical center down the road, you pay 20%. Again, the most concerning part, no out-of-pocket limit.